Today's show is sponsored by Crescent Drugs. Located in Culver City, Crescent Drugs has been serving medical professionals since 1980 and specializes in hormone replacement therapy, dermatological care, pain management, scar therapy, and many other therapeutic formulations. They make custom medications based on your personal needs. Crescent Drugs offers the lowest prices on compounded medications and will meet or beat other pharmacies' prices by 5 to 10%. Mention this show, House Calls with Dr. Judi, and receive free shipping on your order. For additional information, call 1-800-469-4343 or visit the website at crescentmedical.com. Crescent Drugs is located at 5915 Blackwelder Street in Culver City and is a USP 800 compliant pharmacy. The statements or opinions expressed by Dr. Goldstone are published for educational and informational purposes only and are not intended as a diagnosis, treatment, or substitute for professional medical advice, diagnosis, or treatment. Consult a physician or other healthcare professional for your specific healthcare and/or medical needs or concerns. Welcome to South Bay by Jackie Presents. I'm Jackie Balestra.
And I'm Joe Terry.
And this is the first episode of our new program, House Calls with Dr. Judi. Dr. Judi Goldstone specializes in medical weight loss and anti-aging. She graduated from UCLA and Mount Sinai School of Medicine. Dr. Judi is certified by the American Board of Internal Medicine, and she is a member of the American Society of Bariatric Physicians and the American Academy of Anti-Aging and Regenerative Medicine. Her longtime interest in weight loss, optimum health, and longevity led Dr. Judi to open her private practice devoted to helping people get into optimal physical and mental shape. She is well recognized as an expert in weight loss, nutraceutical usage, nutrition, and bioidentical hormone replacement. Now, each episode of this show will focus on a particular medical topic, and today we'll be learning about andropause, what it is, what causes it, and what can be done to alleviate the symptoms. Now, Dr. Judi, you were our guest on the South Bay Show podcast a few weeks ago, and it was such an informative show. We really wanted to work with you again. So here we are making house calls. Welcome.
Thank you so much, and I'm so happy to be here.
Well,
yeah,
yes, thank you.
We were both very excited when we did the show with you a couple of weeks ago. So we're going to jump right into it. Dr. Judi, what is andropause?
Okay, well, andropause comes from two separate Greek words, andro meaning male and pause meaning stop. But andropause is called other things as well, like hypogonadism or male menopause. And it's the time when testosterone progressively declines in a man as he ages.
So that's the technical term. That's the technical definition.
Right. And so, there are so many questions many men have about these changes that occur when they're getting a little bit older. But it starts really early in a man's life, right? As early as the 20s.
Well, testosterone peaks at age 19, and then it falls 1% every year after.
Wow.
So by the time you're 30, it's already fallen to the point where you might start experiencing some symptoms.
Right. So, one of the things that people talk about is this concept of when men become men, when women become women. I know for most mammals, we all start out female. Isn't that right?
That's correct.
And then, of course, a change occurs if you are a man, so that you're in the womb, you get this infusion of testosterone, and all your life you have this. And then in your mid-20s and 30s and 40s, certainly in the 50s, this thing happens, this change for some men.
Well, it's a very gradual decline, so most men don't even notice it until they get to be maybe 50, 60. And a lot of the signs and symptoms are attributed just to getting older, when it really isn't just old age, it's hormonal decline.
So that's hormonal decline is the cause of andropause.
That is definitely the cause. And as you get older, it declines further.
And are we talking strictly testosterone because there's estrogen and progesterone and all these other things?
In men, it's the majority of time it's testosterone, but there are also a couple of other androgens, which are male hormones that do decline. And the whole picture isn't complete unless all your hormones are balanced. So you have to take a look at everything.
Now, we're going to get into all the details, and I'm looking forward to this discussion. We're looking forward to it very much. But I just wanted to take a step back, Dr. Judi, and find out a little bit more about your background and how you began. When you were a young person, were you always thinking about being a physician?
Yes.
When did that start?
God, really young. I can remember when I was about 5 or 6, I thought about it.
Did you have the game board operation?
No, I didn't, because they didn't make it for women. That was a man's game.
What, did you think about becoming a surgeon, or was it always
no.
family medicine? What were your thoughts?
I didn't really know. I think at first I wanted to be a psychiatrist, but that quickly changed when I went to school. But I was always thinking about it and just never thought it was possible.
Right, right. And then it was possible.
It was.
That's amazing. So now you're in school, and you know, one of the things that we talk about a lot is lifestyle and nutrition. There's a tremendous amount of evidence and a talk these days about how lifestyle and nutrition affects your health in profound ways. So can you talk a little bit about how much the typical American medical doctor is trained in the area of nutrition?
Well, I know from when I went to medical school, 0. I had 0 nutrition courses. I didn't know anything about diet.
Wow.
So
Wow.
you had to educate yourself.
Oh, I taught myself everything probably when I started to do weight loss medicine. I started learning about nutrition and diet, and then I took it a step further and learned about all the supplements and vitamins and whatnot.
Right, right. Now, bariatric surgery, many people are somewhat familiar with it, but can you just describe what is bariatric surgery?
Well, my field was bariatric medicine. Bariatric surgery is when a surgeon actually limits your stomach size. There's different things that they can do.
Okay, okay. So how would you be different in that? You would use medication or what?
Yeah, what I would do is talk to somebody, find out their goals, what they want to be, and then pick a reasonable goal. I usually base it on body fat, not really pounds. And then I put together a diet for them to follow. It's very strict, and I have people come back once a week to see me so I can weigh them in, check all their vitals, make sure they don't have any questions and are sticking to the diet, basically. And if I need to, I can use medication.
I see.
Most people don't need to on a pretty structured diet because I keep it liberal so there's enough to eat.
I see. I see. I remember in our previous discussions we talked about a lot of different things, but in terms of activities and or supplements that people can take, there were 3 main activities we talked about, and I'll just go through them one at a time. Weight loss. How important is weight loss in terms of the things you can do to affect your own health?
It's huge. It's probably number 1, I would think.
Yeah.
You have to try to get to a normal weight. Because being overweight, pretty much all the diseases they get are the same diseases of aging.
Right.
So if you're overweight, you're aging yourself right there.
Right. And then, of course, exercise. Everyone talks about exercise. There's, the whole, fitness craze with the various companies that have gyms that you can become a member of. Not only how important is exercise, but how do we utilize and get value from exercise?
Well, I would say exercise is right up there with diet. Those are 2 very huge, important things to age in peak health. Without exercise, you're just going to get stiff and start developing a lot of inflammatory issues. Usually for weight loss, I tell people 45 minutes of cardio 5 days a week.
Okay.
Sometimes I say 7 because and then if they take a day or 2 off, that's okay. But you really have to get at least 5 days in. That's for weight loss.
I see. Now, I know, Jackie, we have several sort of elements to Andropause, and you were about to get through the first element. What are some of the other elements to andropause?
Well, we wanted to determine what caused it, and which you said is the levels of your low testosterone, low hormones.
It's the androgens, the male hormones, progressively declining with age.
Okay, so now we want to get into the symptoms because we can compare this to menopause, which is a whole other show, by the way.
That's
Right? That's a whole other show.
It
a
is.
whole other topic.
A whole other
But
topic.
it is the equivalent of what sort of. You'll explain that.
It
to us.
really is. You know, it's funny that we didn't think of that. We always thought of women with menopause because we have an abrupt cessation of our periods, and that brings on symptoms and menopause. But with men, it's so gradual that it just builds up, and then all of a sudden, when you're maybe in your late 30s, early 40s, you start getting a little bit of a belly, central obesity. You may start losing a little bit of muscle mass. The number one thing that men complain about when they come in is their sex life. They're getting poor erections. They kind of lost their libido, and they don't have energy to perform. And then they also complain about poor exercise recovery. They're just not getting the same benefit when they go to the gym. They can't build the muscle, and then it takes 4 or 5 days to recover, whereas when they were younger, they were recovering in a day. Those are the big ones. And then there's a bunch of other personality things like mood changes, irritability, losing your zest for life, sort of mirroring depression. And we can also men can lose height just from the decrease in testosterone because that builds bones, so they can become osteoporotic.
Okay.
Wow.
That's a lot
That's
of
a
things.
lot. So, and this can start happening as early as your 30s?
Well, I would say
Is it average 50s or 60s or some people?
usually the average age is around, let's say, mid 40s to mid 50s is when they really start to notice it. But I've had more and more younger guys coming in, more and more. I had a guy 27 years old, and he definitely had it. Part of the reason is because there are other things that accelerate the hormonal decline. And I want to talk about those a little bit.
We got to hear about those.
Because, yeah, we have to. Because it's, again, a lot lifestyle, not exercising, being overweight, stressed out. Stress is a real bad one. That can knock your hormones completely out of whack. And burnout, that's what burnout is when your hormones are falling too fast and your body can't keep up with it. Also, people who use drugs, cocaine, marijuana, they do lower testosterone.
That I knew. I had known for some years that marijuana decreases sperm count, right?
It actually decreases testosterone. What about opiates? Opiates, which we have a huge epidemic in this country, lowers testosterone.
I see.
It does.
Wow. So some of the symptoms, no or lowered libido,
Yeah.
muscle loss, not being able to recover as quickly from physical activity, depression. Wow. And then, of course,
All the little minor ones, the mood changes, and some guys even get hot flashes.
really?
Yes, they do. Justice for us, but not a lot, but a few do. They feel warm, they get hot flashes.
Right. Okay.
Interesting. That's interesting. So, do men... I'll ask you this question.
Okay. Do men?
Do men? Yeah, well, no, you're of a certain age. You're of a certain age. Have you experienced any of these?
Well, the hot flash is not yet, but certainly the recovery from exercise, I absolutely. The issues in the bedroom. I mean, every man talks about that. Every man wants to be, 18 again, and when there was no problem in that direction. So everyone talks about that. But there's so many other things here, like bone density loss. That's a scary one. I don't think I've ever heard that generally for men.
Oh, yeah, and there's other things too, other studies that show that men with low testosterone have more myocardial infarctions and diabetes too.
Okay.
So there's a lot of illnesses that are linked to it, not just the symptoms.
Right.
So this is what we could call a natural phase of life for everybody. Women go through menopause.
Women have
if
the
you're
same
lucky to
issue.
live long enough, right? If you're lucky to live long enough,
That's correct.
you'll experience menopause or andropause.
But you don't have to necessarily.
Okay. So we know some of the symptoms now.
Yeah.
Joe is having hot flashes, and he's like, "Where is this coming from?"
Right.
So he needs to be diagnosed.
Okay.
So he's gonna call and make an appointment at your office, and what's gonna happen when he goes in to see you, because he's his bones are a little more fragile.
Yes.
He's getting a little moody, and
but first though, I would have talked to my own doctor. And I would have asked, what's going on? I'm 57, going to be 58. What's going on? And my own doctor, Dr. Judi, would have normally said what? What do you see general practitioners doing in this
Well,
case?
what happens is patients come to me and they say, well, my doctor checked my testosterone and said it was normal. And I'll say, well, do you know the number? And they'll say, oh, I think it was 300. Well, there is a range in every lab test. And for testosterone, we're talking about free testosterone, total for testosterone. There's also free testosterone, which is actually more important. But for totals, from 300 to 1,000, you don't want to be 301 and be told you're normal. You want to be in the upper third of that curve, maybe 800 to 1,000, because that's where you are when you're 25 at your peak.
Right.
And you're not falling apart, getting prostate cancer and degenerative diseases.
Right. So most general practitioners, you're saying, they just do a simple test. If the person is in the range, then they say normal.
If you're 1 point above the lower limit, you're normal.
Right.
And that it's mind-boggling, because even patients know that isn't right.
Right. And your company, SoCal Bioidentical Hormone Replacement Therapy, you're going to take a different approach. So what is your approach in your company?
Well, first, when I see somebody, I take a pretty extensive history. I usually spend about an hour finding out what are all your signs and symptoms, what's your family history, because that makes a difference too. We go over everything, any drug history, the whole thing. Then what I do is I check their levels of all the hormones and inflammatory markers and some cancer markers. I do a very thorough, comprehensive lab evaluation. Then when the patient comes back, I do my physical exam, looking for signs also, and put everything together. The patient and I will guide the patient and tell them what I think they should do, and then they'll tell me what they will do, and then I work with that.
Right.
I have to ask you, tell you about something. A friend of mine several years ago was having some symptoms of a woman. She was having symptoms, and she said, I think I might be premenopausal or perimenopausal or menopausal. So she went to her doctor and she explained some of the symptoms, and the doctor said to her, oh, you're probably low on estrogen. Was it estrogen? I think she said you're probably low on estrogen, and she subscribed her some estrogen supplement, or I don't know what you would call it. And she went a little wonky after that. Went back to the doctor. The doctor didn't actually test her.
Yeah, you need to test.
It turns out that her progesterone was low. So you've got doctors saying, "Oh, you're probably just low on this or whatever." Make sure they actually test you.
You need to test.
Don't let anybody assume what hormones.
That's a very good point, because you have to be tested. You don't know.
In men, could it be that one of their other hormones is low?
Oh, sure. I mean, low growth hormones sometimes mimic some of the symptoms of low testosterone, as well as DHEA, which is another androgen, meaning male hormone. Women have it too, though, but it builds bone and muscle. That could be off. I check all your hormones. Cortisol, the stress hormone, is huge. If that's off, it can create a lot of these symptoms as well. So you have to go by the person's story, the signs, and then what they're complaining of, then what you see on physical exam, and put it together with the lab. I'll never treat somebody just based on one lab report. For testosterone, I'll get the total, the free, and the bioavailable, because the total is not really what's usable. You need to look at the free, and that's where a lot of people make a mistake. They don't look at that.
I see. So now we're getting a clearer picture that it takes not only a panel of testing of various hormones, but also within range and not near the bottom of the range.
Correct.
Or not near the top of the range. You have to analyze.
Right.
And that takes an expert. That takes a specialist.
Right.
How many special practices are there that do bioidentical hormone replacement therapy like yours?
Well, that's a good question. It's getting to be more and more because every year I go to this big conference from the American Academy of Anti-Aging Medicine, and then they have the World Congress of Anti-Aging Medicine, which I go to. So around the world, you can see every year the audience is getting bigger and bigger. In the United States, I would guess boarded anti-aging specialists who are members of the society, maybe about 300.
Right.
Really, in the whole country?
Yeah, there's not a lot.
Right.
Well, considering that we are smack in the middle of the senior tsunami,
Right.
which is, give us those numbers again.
Yeah, basically from now, the first baby boomer turned 65 January 1st, 2011, and for the next 20 years, 10,000 Americans are turning 65 every single day.
Oh, I heard that.
And it's incredible, this wave of older adults that are having these symptoms potentially. Obviously, it affects everything. It affects our medical systems. It affects our pension systems. Many municipal governments are having huge financial difficulties because of all of these firefighters and other first responders that are now aging and collecting their retirement benefits. So it's a huge societal benefit.
It's far-reaching.
Effect.
It's far-reaching.
Yes, it sure is.
So anyway, before we go on to
Right.
the next topic,
Yeah.
we're going to take a short break
Okay.
to thank a sponsor, and we'll be back in just a minute with
Great.
House Calls, Dr. Judi. This portion of the program is sponsored by Your Actualized Visions. A local advertising agency, Your Actualized Visions offers all your advertising needs under one roof. From logo design, business cards and signage, to website design, SEO, social media, and more, Your Actualized Visions will get it done on time and on budget. Your Actualized Visions is competitively priced and economical, saving you money and greatly enhancing your bottom line. Customer service is all local with one point of contact. No more dealing with robo-answering machines or getting the runaround. Your Actualized Visions understands your hyperlocal advertising needs and focuses on bringing you real clients who want to purchase your services or products. For additional information, call 310-413-8773 or visit the website at youractualizedvisions.com. And we're back. House Calls with Dr. Judi, and we've been discussing our topic today, andropause. And we've gone through some of the symptoms, what causes it, some of the symptoms, and how you get diagnosed. And we were talking about that just before the break.
Right.
Did you want to...
Yeah, there was one more thing regarding Joe's question about how many people practice this. Well, there are a lot of low T clinics popping up, and even in spas you can find people who say they do bioidentical hormone replacement, but you have to be careful to look into the background. Your best bet is a physician who has been trained through the American Academy of Anti-Aging Medicine, who really knows what they're doing, because you can be damaged more by going to one of these, clinics that open up overnight.
And they're just trying to capitalize
Correct.
on this concept of low T. You're hearing that
Yeah,
low T, right?
Yes, yes.
And so they are opening up almost in every mall, I guess, across the country, right? A low T clinic. Because
I haven't seen those yet.
Oh,
Right.
they are.
I
they
haven't
are.
seen those yet.
I'm an entrepreneur, so that's the first thing that comes to my mind is,
They're all
whoa, low T, I can make money, right? So, yeah.
Not with that, you don't want to.
Yeah.
But
So you don't want to go to one of those places
No,
because you
you
need to be screened.
Right.
well,
You'll-
they don't test people right. They don't follow up on them properly, and they don't even give them the right things to block certain things that happen when you take testosterone.
Right.
You have
And
to-
it's not just testosterone. There's a whole panel
Right.
of hormones that have to be tested. and where you are in the range on all of these things.
Is that similar to a cholesterol? There's the different types of the good cholesterol.
HDL,
Yeah, the good cholesterol.
and
the bad
LDL.
I
cholesterol.
check for that too. But for the hormones, it's like, for example, somebody might go to a testosterone clinic and be put on testosterone, and they never check their estrogen or their DHT, which is testosterone, a very strong testosterone, which comes from testosterone. If that builds up, you can get potentially prostate cancer and hair loss. You need to block those things.
So it's possible to get too much testosterone.
Well, yeah.
People could be
Sure, that's always
get a
possible.
dosage of.
But your own body can convert it. You don't know how, if you're going to be converted or not. You have enzymes there which convert the hormone sometimes to estrogen. So you could be taking testosterone, but really giving your body mostly estrogen, and that's so damaging, especially in a man.
Yeah, that could be a little confusing, I would imagine. So you have the symptoms. Joe's our guinea pig, our patient. So Joe has experienced some of the symptoms.
Yes.
It's happened enough that he spoke to his wife about it. He maybe spoke to some of the guys at work. He finally went into his GP.
Right.
The doctor said, yeah, we could see you might be a little low on testosterone. And the minute he hears that, he says, I need to go to a specialist.
That's exactly what happens.
So he goes in, he makes an appointment to see you, Dr. Judi. So you're going to go run him through this battery of tests.
After I find out if he has any signs or symptoms, I don't just go by a lab test alone. You have to have signs and symptoms. And believe me, if your testosterone is 301, you're going to have symptoms.
So you're going to do a complete medical history.
I do
You're going to do a series of lab tests.
I test all the labs.
You're going to get all this information. And then you're going to say to Joe, okay, so these are your options. How do you manage it?
Okay, what I say is, we're going to replace the testosterone, we're going to talk about the different ways to do it. There are patches, creams, gels, injections. There's even pellets where you can have it inserted under your skin, and it can last supposedly for 3 months. So we talk about the pluses and the minuses. I never tell anybody to take oral testosterone because that leads to liver toxicity. So that's something you should watch out for. Never go for a pill that you can swallow to replace your testosterone.
That's the same
dangerous.
reason why they changed for women estrogen. They started doing patches and creams because taking it orally caused different cancers.
Right.
Yeah.
Okay.
So we'll talk about the different forms, and together with the patient, we'll figure out what they're willing to do. Some people don't want to do the shots. They want to start with the cream, and that's fine.
How long does a shot last? If you come in once a month?
It usually lasts only a week. Well, we teach the patients to do it themselves. They usually don't have any problem.
Oh, really?
Yeah, they do it at home, and I check them about every 3 months to make sure that the estrogen isn't going up, that the dihydrotestosterone isn't too high, that the testosterone isn't too high. So I'm following all that with them.
Okay, so you can a patient can, if they have the wherewithal to take it upon themselves to give themselves a shot once a week.
Yeah.
And that automatically, I think, I worry about overdosing.
Yeah.
No, actually.
Men that want to be like,
Well,
I could have bigger muscles. Let me take some more of this stuff.
You're right about that, but those guys, I immediately weed them out because you can tell.
Yeah.
But I have very few of those. Most people are very good. They want to follow the directions because they want to be better.
Right. Right.
That's what they're coming for.
I certainly would want to be better, and a weekly shot even. I'm thinking I would go for the subcutaneous. It's a
Pellets.
A pellet.
Well, you can
does that
do
work?
that, but my impression of the pellets is that what I've seen is that the release is not even. Sometimes you might get a big burst of testosterone and then it may peter out. I'm not too fond of those.
I see.
And it's also permanent. Once you put it in, you can't take it out.
I
So
see.
if you hate it, you're stuck with it.
So what happens when you get that burst of testosterone? All of a sudden that pellet doesn't function the way it's supposed
Well,
to?
it might still function, but it's erratic and irregular.
And what kind of physical symptoms would you have if you were flooded with testosterone?
Probably you break out with acne.
Oh, wow. Okay. Wow, we didn't mention that before. Acne.
Well, we could talk about
Don't
the
we
side
were over that
effects.
when we got out of high school?
Oh, no, you can get all kinds of... I've never seen the rage that people talk about, but guess potentially you could get pretty aggressive.
Wow.
It can make your blood count go real high and shoot up your blood pressure, possibly give you headaches.
Oh, wow.
Hair loss.
Well, that's if it converts to the dihydrotestosterone. A lot of time those people come to me and they're not on anything to stop that. Saw palmetto is an excellent supplement which stops that conversion.
Right, okay. So the cream. So the cream is not, that's probably the most popular option?
Well, the gel, I think men like gel or cream. And
these are both topical?
Yeah, they're topical. You usually put it on the back of your shoulder. The only thing about that is you have to do it every day.
Right.
And, sometimes it gets a little messy and it's, they don't really like it that much, but some people do. You definitely get better results with the injection.
Okay.
And are the injections, okay, so you said they once a week?
Generally once a week.
Generally once a week. And how long do you have to do that for? Like, for the rest of your life?
You don't have to do it at all. But if you want to stay healthy and fit and keep your muscles in good shape and lose that gut and be sharp, potentially you would do it your whole life.
Wow.
You do take breaks here and there because if you constantly flood your receptors with testosterone, they may just not be receptive anymore. So periodically I have my patients go off, take a little break.
And you're monitoring them all this time?
I'm monitoring them through the whole thing.
Are there any foods that we can eat that will help, or supplements that we can take that will help moderate our testosterone or even elevate it?
Okay, well, there's all kinds of things out there. First of all, you should be eating mostly a plant-based diet and an anti-inflammatory diet, which is all over the internet. You can go find what the diet looks like by just going under images and putting in anti-inflammatory diet. It's mainly fruits and vegetables and very little meat and very few sweets and grains, so-so. Complex carbohydrates are usually okay.
Okay.
Supplement-wise, there's all kinds of things out there, but I see the people that come in having been on all of those and none of them really worked, so I can't say that anything is that great, except there is something called nettles, which will free up testosterone if it's stuck on your proteins.
Nettles, is that any relation to stinging nettles?
It's the same thing. It frees up testosterone, but even with that, I don't think that would raise it enough that it would make a big difference.
I see. So it really is, once you've been tested and you've determined that this is necessary, some raising of the testosterone, then you're going to have these sort of categories, it's a once a day cream,
or gel,
once a week, or gel,
or patch.
Or a
There's
patch. Okay, sure.
And there's also one other thing I want to mention. They have what they call a buccal testosterone. It's an implant that you put behind your tooth, and you have to change it twice a day. I think that would be inconvenient too. I don't use that.
That just sounds annoying.
It does.
That just sounds annoying.
Nobody goes for that, but I thought I would be complete.
The $64,000 question: Does insurance generally cover something like this?
Oh, usually not.
Usually not.
Right.
Because they don't think of hormonal decline or taking testosterone for prevention is worth treating. They're waiting for you to get a disease.
Wow.
Wow, that's an interesting way of putting it. Wow. What are we forgetting to ask about this topic? Did we cover everything?
Side effects?
Oh, yeah. Let's hear about side effects.
Side effects. Who can't do it? First of all, most people can do it, but if you have severe sleep apnea that's untreated, I probably wouldn't have you take it. Also, if you had a high blood count, red blood cell count, I wouldn't let you do it because testosterone elevates your red blood cell count, so I don't want to make it worse. Also, men that have had breast cancer or prostate cancer shouldn't take it. Not that it causes prostate cancer, because there's a lot of good literature that shows that testosterone does not. But if you have active prostate cancer, you don't want to even tempt it.
Right. Okay, so there are some caveats and some
like anything,
cautions.
but you want to talk to an expert. Right?
You really do. And for the side effects, the main thing I really see is the acne and the high blood count. So I usually have patients go and donate blood quarterly, and that solves that problem. But if you don't do it, that can lead to high blood pressure, maybe headaches.
That's interesting. But donating blood will alleviate the symptoms?
It takes away the high blood count. When they draw off a unit of
That's
red blood
interesting.
cells,
Yeah.
then your count falls and you're okay for a little while.
And you only have to do that how often?
Well, usually quarterly. Some guys never have to do it because it just doesn't go up, but in most guys it does.
Right. Wow.
We learned a ton of stuff today.
Yeah, that's
this
very
is
helpful.
There's a lot to know about it.
Yes.
Yeah, and you've given us a lot of great information. And anybody out there that has any questions, if you're experiencing symptoms, Dr. Judi, she's the expert. So, what topic will we be discussing next time?
Menopause.
Menopause.
Women their due. This is an equal opportunity show.
Yes.
Right.
No, we have a whole list of topics that we're going to get into. Nutrition.
Right.
You have a ton of information on nutrition. We've already learned a lot from you. I'm already taking my omega-3 and my vitamin D and my B12 complex. Anyway, thank you so much, Dr. Judi. And we'd like to thank Manhattan Beach Studios, our video production team that manages every single detail of our shows.
Right.
Now, if you require video or photography services, you can call 310-800-1999 or visit the website at manhattanbeachstudios.net. Thank you for joining us for this episode of South Bay by Jackie presents House Calls with Dr. Judi. Until next time.